And if the system is confused, we will get what we are. So is the word of God. Amen.
That's right.
Our regulator in Dombi many. I mean, we've discussed a lot of issues, a lot of points. I know there are still many questions you would like answered, but unfortunately we have to end this session so we can get on to the other sessions that we missed earlier on. They are around for engagement. HEFRA table is at the back, as we've been reminded. And please, those who haven't registered their facilities, know that you are a professional quack until you have re-registered your facility, until you have re-registered yourself. And in fact, there are some people who actually registered but didn't check to see if they were complimentary, so that you don't have yourself wanting when a situation arises. So on that note, we thank Dr. Divine Ndombi Banyubala and Dr. Winfred Koletiba for honoring our invitation and supporting us this far. Thank you very much, gentlemen.
Thank you.
I think we can do better for panelists and Madam Moderator. Thank you very much. So we'll continue our engagements. The next session will be moderated and chaired by one of our own. He's an elder of Pentecost, the GMA chairman for the Bono and one of us. Please let us welcome Dr. Dent Elder Paul Akwesifrimpong.
All of you for the honor done me, and I will need your support and your full cooperation to ensure that we have a successful second session. Thank you very much. So on this session, you have two presenters. I will introduce the first speaker, and then he will do his presentation. Then the second speaker will also follow suit. So the second speaker will deal with the topic, United Against Quackery, Building Multisectoral Partnership for Safer Dental Care. And that will be done by one of our very own senior professors. He's an associate professor in oral and maxillofacial surgery, also the dean of School of Dentistry, KNUST. He's a consultant oral and maxillofacial surgeon, works with the Conventional Teaching Hospital. He holds a degree in LLB and also has further specialized in oral and maxillofacial surgery through fellowship from the Ghana College of Physicians and Surgeons and West Africa. He completed a postdoctoral fellowship in global health research at the University of Michigan. He is a man of many accolades, but to wrap it up, Prof. Alexander Uti Echampong will be our speaker for the first session of the scientific teaching. Let's give it up to him as he delivers his topic on combating. Prof, you have the floor. Thank you.
Thank you very much. Thank you very much, Dr. Paul Frimpong. So this afternoon, I'm sure we have all quackery that we have. So my presentation is going to look at how we can collaborate with the various next. So that would be the outline of registration from a legitimate institution. And then it can also be someone, even the training is not up to that particular. Okay, so it has social effect, and then it can also affect the people involved. the whole idea is that quackery tends to, try and then do some kind of misrepresentation for people to trust the individual that look, you can perform what you think can be done. Next one. Okay, so in dentistry, practicing dentistry without authorization or training is a form of quackery. Next, okay, in Ghana, so by herbalists, you can also have all proper certification and your product like places that they have on the market, tooth whitening powder on the people wanted to know coming from. Fake dental, my friend said, people can inherit a certificate. I don't know how they do the inheritance, but it's possible. Okay, and then we have unregistered mobile clinics. But now I've been told that if, let's say, you have a dental school and you have a mobile dental van for this particular outreach, can we also classify that one as unqualified, or let's say as a quack thing? Okay, so let's quickly try and look at some of the quackery cases. I try to get examples from Ghana through other African countries. So this one, without training. And you see, most of the time, as the registrar said, they are, it is coming from us. I mean, the problems that we are facing is coming from us. Okay, so in a dental lab, other jurisdictions, I think they have what is called the juries. Okay, is there? But in this particular case, you go there, it's be a dentist for the dentist to take the impression. They will go ahead and do everything. If you need tooth extraction, they will perform everything for you there. So that is what they do. Okay. This man was also arrested, and look at the outcome. So the clinic was just shut down. Okay, and I don't know the rest, but this is a case from Nigeria where you go out and there are kiosks all over your places. He mentioned Kumasi. Kumasi is there. If you come to Oforikrom there about early in the morning, you go there and the tools are there, and people march the top there and did extraction for the patient. And we only got to know when the person was bleeding profusely. Okay, and it's all because he wanted to just pay less. Okay, okay, so that's one. Tooth whitening is now a major issue now. People think that you can buy and still go ahead and do it, and because there is money in it, buy a mouth retractor. So I was like, we have to jewelry, put diamond and other things, gold in between your teeth. People go to this unregistered places and even the concept of infection control. They just try and wash the instrument and clean it with a towel. And the next patient will come. This scaling and polishing thing, they buy the machines and they are also using it. They don't even sterilize even the tips. So it has health implications and then economic, social, and professional impact. The reason why it has professional impact is that when people go to such places and they don't get the best form of treatment, in fact, they tend to lose trust even in the very good your professionals who are not your quacks. Okay, next slide. Okay, so why quackeries in Ghana? As I said, we will go to the effective, the collaborative effort. I don't believe some of the things that I got from the internet. But this is what they are saying: lack of access. I think Dr. Ruby Goka will agree with me that has been complaining that in water region, even though they have a lot of nice dental clinics, people are not willing to go there. And if they are not willing to, I started doing some small business, and I realized that the national health insurance system is not good. It is not even helping dental. Okay, so the issue of affordability, if the tariff there is not sufficient to even buy the materials, how are you going to make your profit out of that? So there is also low awareness. The people around cannot tell whether you are a dentist or not. So that is what, and then enforcement is not there at all. Maybe it's there, but we don't see it because sometimes, and I also believe that maybe we don't even know the reporting, like how to go about it, because sometimes you see cases and you don't know who to talk to. Okay, so that can also be a problem. Next slide. Okay, so when we talk about the multisectorial approaches in combating this madness, these are the few groups of people that have been able to identify, and I will not go through all the list because some of them have even explained themselves. Have the issue Medical and Dental Council, the GDA, law enforcement, the role of the media, nationals, and then national health insurance. So I'll take about 2 or 3, okay, to talk about them. Okay, so in the area of the academic and then research activities, we have the dental schools. Okay, we have to try, and then we know there is a course called community dentistry, but most of the time everything is done in the clinics, and I believe that one of the ways that we can improve upon access and also to encourage people to go into such communities is to start right from the onset when they are in schools, so that if they're receiving a health center and then student to even spend a week or two there. That is also a follow to know build the people through the system for them to do the oral health education, and then there should be a system where proper research should be conducted. If we are saying that people are not going to the rural areas, why are they not going? Why are they all here? Why are they all in Kumasi? You go to certain hospitals, they have only one dental chair and they have about five dentists. Okay, what is happening? What is happening? You can't blame them. And then the issue about curriculum development. I have a problem with the universities, the way they run your programs. Because when you are running a program outside the main dental course, you should be very specific. Okay, you don't where you train somebody that you term to be a certain supervisory role, and you know that in our system we don't have the supervisory role. You can extract only when they go into the communities. Do they extract only the senior states? No. You say that, oh, they can take impressions. When they take impressions, won't they do the other things in addition? If you say that these people can also do maybe perpectomy, continue and do the RCTs. Okay, so I have a problem with the way program, and it looks as if I just taking money out of the students. So that is why sometimes they run. Okay, sorry, coffee. So sorry, sorry. Okay, thank you, thank you. You did not add them. You did not add. In fact, there is a program called PhD. Okay, so no, if you have that person finishing a PhD, the person is not a doctor. He will call himself what? What? A doctor in what? He is a hematologist. How would the patient tell the difference between a proper doctor hematologist and maybe a laboratory scientist who is a hematologist? So the university is creating some kind of courses that are really, really market. So that is why the people come out to be like what? A doctor. So active. Okay. And I'm happy that during the time that registrar was talking, he mentioned the fact that now they are getting support from GDA. GDA is maybe the universities and then the MDC. That is maybe the universities and then the MDC. That because of ABC, they don't include this, you can add this one to it. Because otherwise, GDA should not only be about annual congress, and I believe that GDA can do more. Thank you. Okay, slide. Okay. So my issue with the national health insurance, please next. Okay, I don't know if you can see the Esther. Please have a look at this one. Additional health director. Look, if you or you have a do scaling of NHIS is going to hello 34 cities. So now if you are talking about the fact that people should come to Manya Crop and come expressing to come out with expressing multisections. So the point is, if you want to increase access, please have a look at this one and develop to my board member then. Okay. Go back and look at it. Because otherwise we can't move forward. We can't. Them to charge 34. You are talking about access. Please go back and show them. Okay, please go back and show them. How much do you think this one will cost? From Golden to the or let's say you have to see about 20%. You have to see about 20% to be able to the platform. If I bring my facility to a